Hello students. Students, in today's lecture, we are going to cover some basic definitions on forensic medicine. These are very commonly asked as Viva question exams, and sometimes short notes also come, and very commonly MCQs also come. These are given in every standard textbook as the in the first chapter of Introduction of Forensic Medicine History. So let's start today's PowerPoint and learn these basic definitions. So, students, the first definition is forensic medicine, a very commonly asked definition in exams. What is forensic medicine or define forensic medicine? Students, sometimes the examiner asks from where the word forensic comes. What is the meaning of word forensic? So, students, the meaning of word forensic is forums. The word comes from forums. Forum means group of people who are trying to solve a problem, sitting together. They're discussing a problem to solve it. So this comes from forensic comes from forums, also used in courts of law. Forensic medicine is also known as legal medicine. So what is forensic medicine, students? It deals with the application of medical and paramedical knowledge to aid in administration of justice. Now, students, let's just try to understand it. Now, students, we as doctors have the knowledge of human body. We have the knowledge of disease and why the person has died. As a doctors, we read that, we studied that. So, whenever there is a question like a patient who has come to us, who has been assaulted, who has been beaten by some people, or death of the person has occurred due to unnatural causes. Unnatural causes mean the person has not died due to old age or some natural disease like cancer. Person has died unexpectedly due to some kind of unnatural thing, unexpected thing like he has been killed by somebody, it's a murder, or the person has committed suicide, there's suspicion of suicide. Or the person has met an accident, the accident can be a road traffic accident, it can be accident in his service, in his occupation, industrial accident. Now all these cases come to a doctor. A case of sexual assault also come where the allegation of sexual offences there. The lady has been raped or molested, or even poisoning cases. The person has consumed a poisonous substance. So in all these cases, students, we as doctors, we examine the patient, and there's expectation from the police that we will, as doctors, will be will be recording and documenting the injuries present on the body of the patient. We will also collecting evidences which will be used by the police in the courts to prove the case. So here doctor is using his knowledge, is applying his medical knowledge to help the police to bring justice. So that's the forensic medicine. Deals with application of medical and paramedic knowledge to aid in administration of justice. So I hope the definition is clear. In short, it deals with medical aspects of law. So very important definition, very commonly asked in exams with examples. So let's move on to the next definition. The second definition students commonly asked in exams is medical jurisprudence. Define medical jurisprudence. Now students, let's understand what's medical jurisprudence. Now, students, when we as doctors are treating our patients, we have to treat patients as per the laws of India. Just an example. For example, a patient is there. Patient has come to us. She is a pregnant lady who doesn't want a child due to some medical reason. And we need, as doctors, and she needs a service to abort the child. Now we have to do that as per the rules and laws, as per the Medical Termination of Pregnancy Act 2021. As per that law, as per the MTP Act, only we can do the abortion. We can conduct the medical termination of pregnancy. Doing it outside the laws, doing it outside the provisions of the MTP Act will be called an illegal criminal abortion. For example, students, another example. Let's take another example. If a patient has come to us to get a surgery and the patient needs a surgical procedure to be done, we have to, as per the laws, we have to take a written informed consent from the patient before doing the surgery. The patient has the right to know what's happening to his body, what we as doctors are going to do to the body, what will be the consequences of the surgery. That all has to be informed to the patient and a written informed consent has to be taken. So let's read the definition. Medical jurisprudence. Juris means law, students. What is the meaning of the word juris? Law. Prudentia means knowledge, knowledge of law in the field of medicine. It deals with legal responsibilities of the physician. It's the legal responsibility of the doctor with particular reference to those arising from physician-patient relationship. Whenever we are treating a patient, we accepted a person as a patient, a physician-patient relationship has developed. There's already a physician, we have entered into a physician-patient relationship with the patient, and now because of interaction with that patient, we have some legal responsibilities. As per the rules and laws only we can treat that patient. We have to follow these rules. That is, this study is called medical jurisprudence. And because if we do not follow them, there can be cases of medical negligences. We have to take the information. What are the rights of the patient? Patient has right to second opinion. Patient has right to know what treatment is given to patient. There are multiple rights which are given in syntax. We will covering them in our next videos. What are the duties of doctor? What is professional misconduct? If we are not following our laws and rules, we may get into serious trouble of professional misconduct. So what are your medical ethics when dealing with patients? So all this study of these rules, these laws, these ethics comes under the purview of medical jurisprudence. In short, it deals with legal aspects in the practice of medicine. That while you practice, we are applying all this knowledge, these laws, we are practicing our medicine as per the Indian laws. That is medical jurisprudence. So I hope the definition is clear. Now coming to the next definition, very commonly asked in exams, medical ethics, very, very important. What do you mean by medical ethics? So now these are the basic moral principles. It's the moral principles, it's our values. In Hindi we call it sanskar, our naitik, hamare naitik mulya, our moral principles, which should guide the members of the medical. As a doctor, we should follow these moral principles when dealing with the patients and each other and the state. State means government. So the moral principles which should guide us, we should apply in our practice when we are dealing with the patients. We're dealing with our colleagues, our nurse, our own doctor colleagues, the nurses, the staff in the hospital, and even when we are answering to the state, answering to the government on some matter. Example, taking of consent of the patient before surgery is a medical ethics. It's the moral responsibility to explain everything to the patient, to give proper information to the patient, and take a written informed consent from the patient before surgery. Whenever a patient comes to us, patient reveals lot of their personal information to the doctor, which the patient will not reveal to anybody else. The secrets, the habits, all that comes under patient confidentiality. It's the moral responsibility of the doctor to keep it confidential, not to discuss it with anybody else. When dealing with patient, our first responsibility should be benefit of the patient. When we are treating the patient, the first consideration of doctor should be, is my treatment going to benefit the patient, maximum benefit to the patient? Justice, no discrimination on any grounds with the patient. No harm should come to the patient. So these are the moral principles which guide our practice students. Now coming to the next definition, commonly asked in exams, very, very important, medical etiquettes. So here many times students get confused into etiquettes and ethics. We'll see that how they are different. Medical etiquette deals with conventional laws of courtesy. Basically, it's our manners, it's a courtesy. Ethics are not manners, students. Ethics are moral principles, are हमारे संस्कार, नैतिक मूल्य हमारे. Etiquettes is our manners, how we behave with members different. How one doctor should behave with the other doctor. This is medical etiquettes. Example, a doctor, a colleague of mine who's also a doctor, comes to my office, comes to my clinic to take consultation. I should not charge consultation fee from another doctor. This is medical etiquette. It's my manners. Because the other person also doctor, I am also doctor. We have studied the same subjects as MBBS doctors. Maybe now we are different specialists. But the person who has come is from my own medical friend. He himself is a doctor. He also has knowledge of doctor. He also knows what he's suffering from. Because I am the specialist, he has come to me for consultation. So it's my medical etiquette that I should not charge OPD consultation fees from another doctor. Very, very important. Please do not confuse it with medical ethics. When another doctor comes to your clinic, you should attend that doctor on priority. You should not make the doctor wait. This is again a medical etiquette. And why? Because for you, your time is important. You are seeing your patients. The other doctor has come to your clinic, to your OPD. His patient will also be waiting. The patients of the second other doctors come to us will also be waiting. So we should give priority to a doctor so that he's free, he can go back and attend his own patients. These are called medical etiquette, the respect we give to other members of one or medical fraternity. How one doctor should behave with another doctor. These are medical etiquettes, friends. So I bet the difference between medical etiquettes and the medical ethics is clear. In medical ethics, we are following the moral principles when dealing with patients, when everybody in a profession. Here, it's the laws of conventional laws of courtesy towards the other members of the same profession, that is the medical profession. It's not medical etiquette and nothing to do with the patients. Now, coming to the next very important definition, very commonly asked in exams, clinical forensic medicine. Now, what is clinical forensic medicine? Students, just remember whenever the word clinical is there, that means it's about patients. Word clinical is in reference to patients. For example, a patient of injuries has come. The patient has been assaulted. Now, as a clinician, my duty is to examine the patient. As a doctor, it is to examine the patient and treat the patient. But now, as a clinical forensic medicine, I am not only treating the patient, but I also have to document the evidence. Police might come and ask me I have to register an MLC, I have to inform it's my basic duty as per the law that I inform the police whenever a patient of assault is there, I have to register an MLC. So here we are doing both the things. We are also treating the patient, we also have legal duties. So I am treating the patient as a clinician, but as a forensic medicine, as a part of forensic medicine, a legal duties, we also have to inform the police, we also have to make an injury report, giving our opinion about the injuries, how that injuries could have happened, are these injuries serious, are these injuries life-threatening. Based on that, the police will file a case, extra case. So in clinical medicine, we are dealing with both the provisions of clinical services, that is by diagnosing, treating the patients, and we are also taking care of the medical aspects of that case. So I hope this definition is clear, very, very important. Now coming to the last definition of today's presentation, very commonly asked in exams, define forensic pathology. So in forensic pathology, actually what we are doing, we are trying to understand, for example, a patient has been suffered injury, patient has been violated, he has been hit by somebody else. Now what kind of injury was that? What effect that injury had on the body of the patient? Was that injury life-threatening? If the death of the patient has occurred, person has occurred, we are doing the postmortem as doctors. Now could this injury have caused the death of the patient? Basically in forensic pathology, we deal with the study, we are studying the application of the effects of violence. The patient has been violated, he has been attacked by somebody, some trauma has happened to patient, or some unnatural way. Unnatural has been poisoning. For example, patient has the patient been poisoning. Now what this violence or poison what effects it had on the human body. We are trying to understand and study that, and we are trying to determine the cause and manner of death. Whatever poison or whatever injury was on the body of the patient, has that caused the death? How did that thing cause the death? So all that understanding comes under the domain of forensic pathology. In cases of violence, suspicious unexplained deaths, sudden death, medically unattended death, all these cases where the cause of death is not known. Patient died suddenly, we don't know how he died. Suddenly a patient is found unconscious, brought to hospital, examination, the patient is dead, we don't know how the patient died. A person's body found on the road, in a room, we don't know how the person died. So in all these cases, friends, students' postmortem will be done, autopsy will be done, everything will be examined, and then the doctor will form an opinion and tell the police. So friends, these are the 6 basic definitions, very commonly asked in exams. Definition of forensic medicine, medical jurisprudence, medical ethics, medical etiquettes, clinical forensic medicine, and forensic pathology. So you should know as MBA students all these 6 definitions for your exams. So this is enough for today's lecture. In next lecture, we'll meet with another important short topic. Thank you.